Health, Education, Labor, and Pensions will please come to order. Senator Murray and I will each have an opening statement, and then I'll introduce the witnesses. Then we'll hear from the witnesses, and the senators will each have about 5 minutes to ask questions. For the last 7 years, Republicans and Democrats have been locked in a debate about health insurance, primarily the individual insurance market, which is important, but it's where only 6% of insured Americans get their health insurance. But the hard truth is we will never get the cost of health insurance down until we get the cost of health care down. So today we're beginning a series looking at how to reduce health care costs, including examining administrative costs, waste, how to improve transparency, private sector solutions, and other important issues as they come up. According to the World Bank, the United States produces 24% of all the world's wealth, for just 5% of the people who live here. And according to the Centers for Medicare and Medicaid Services, in 2016, we spent 17.9% of our wealth, our gross domestic product, on health care. And CMS projects that share will rise to nearly 20% by 2026. The United States spends a significantly higher percentage of our GDP on health care than other countries. However, I expect several witnesses here today will say we should be cautious about how we compare the United States economy to other countries around the world when we're discussing health care costs. According to the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services, which is the Health Data Office at HHS, we spend $2.2 trillion on health care in 2006. That's projected to grow to $5.7 trillion in 2026. That's a 159% increase. Warren Buffett has called the ballooning cost of health care, quote, a hungry tapeworm on the American economy, unquote. What does this mean for families and for businesses and for taxpayers? According to the HHS Health Data Office in 2016, American families spent an average of $1,095 per person on their health care, up from $705 a person in 2000, not including insurance premiums. Most people don't even know what they're paying because medical bills are so confusing. In 2016, according to HHS Health Data Office, private businesses and employees paid for over half the $3.3 trillion we spend on health care, which is money that is going to increasing health care costs instead of paychecks and bank accounts. And according to the Congressional Budget Office, American taxpayers spend more on health care programs than anything else, including our national defense and the National Institutes of Health. The first step to reducing health care costs is to better understand the cost of health care in America and understand why health care in America costs so much more than it costs in other countries. Most obvious fact about health care costs, other than that they're too high, is that they're often indecipherable. Any one of us who's received a hospital bill in the mail or has tried to figure out their health insurance benefits has wondered what it all means. And the complexity of the healthcare system not only means it's difficult to determine what is driving up the cost, but this complexity itself is driving up the cost of health care. Over the last 18 months, the HELP Committee has had hearings on 4 different areas of health care spending. 1, the cost of prescription drugs. Why is the cost paid by patients rising, and what can Congress do to help? We saw the complexity of the health care system in the list price and rebate process, which seems to benefit everyone but the consumer. 2, wellness programs. There's a consensus, and we heard about it, that a healthy lifestyle helps people live longer and better lives and reduces health care costs. 3, 340B drug pricing program. According to researchers at New York University and Harvard, the New England Journal of Medicine, the 340B drug pricing program incentivizes consolidation in the healthcare industry, which reduces competition and drives up costs. And 4, electronic health records. The federal government has spent over $38 billion incentivizing the adoption of electronic health records to help share data, improve care, and reduce costs, only to find that electronic health records do not work very well, add tremendous administrative burden to doctors, and are expensive to maintain and update. Now the committee is going to focus on ways to reduce healthcare costs, and before we come up with solutions, we want to understand the drivers of healthcare spending. Who is spending all this money on healthcare? What is the money being spent on? When in a person's life do they spend money on healthcare? Where does the money go? According to the HHS Data Office, 31% of the $3.3 trillion we spent on healthcare in 2016 was for care in hospitals. 20% was spent on physician and clinical services, 5% on nursing care and home health, and 10% for prescription drugs that we pick up at the pharmacy. But according to witnesses at our drug pricing hearing, the percent we spend on prescription drugs is closer to 17% when we account for prescription drugs given in a setting such as hospital or nursing facility. The average American is shocked by the cost of health care. They don't understand what they're being charged for and why it costs so much, and they want better answers. We hope to find those answers. That's what I heard from Todd, a Knoxville, Tennessee father who recently took his son to an emergency room after a bicycle accident. They paid for Todd a $150 copay because the emergency room was in network for his health insurance and they headed home. So Todd was surprised when he received a bill for $1,800 because even though the emergency room was in network, the doctor who treated his son was not. Todd wrote me trying to find out why it's so hard to understand what health care really costs and said, if I'm expected to be a conscientious consumer of my own health care needs, I need a little more help. Well, maybe we can provide a little more help for Todd, individuals like him, employers, and other taxpayers as we take the first step toward reducing healthcare costs by understanding healthcare costs better. Senator Murray.